Good afternoon everyone. My topic is Tacrolimus and the combined use of tacrolimus with olopatadine in VKC comparative prospective study. Allergic eye disease is a common ocular condition that we encounter in our clinical practice. Vernal keratoconjunctivitis is a recurrent bilateral interstitial self-limiting allergic inflammation of the conjunctiva having a periodic seasonal incidence which subsequently affects the cornea. The topical use of antihistamines, mast cell stabilizers, and more recently the combined effect of both, termed as dual action drugs, represent the first line treatment for VKC. In most severe forms, corticosteroids are used for short term to induce the remission of the allergic crisis. Tacrolimus, a macrolide bacterium Streptomyces tuberculosis derived, is a potent immunomodulator capable of decreasing the production of inflammatory mediators by T lymphocytes through the inhibition of calcineurin and intracytoplasmic protein essential for interleukin 2 and 4 transcription. This study is focused on comparing the efficacy of tacrolimus versus tacrolimus with olopatadine as therapy in VKC. My aim of the study is to determine the efficacy of topical 0.03% tacrolimus as a single versus its combination with 0.1% olopatadine VKC. It's a comparative prospective study. The sample size 50 patients were taken and were divided into two groups, group 1 and 2. The study center was Department of Ophthal in IGH, Rourkela, and it was conducted over a period of 3 months. Inclusion criteria: all VKC patients refractory to conventional therapy coming to the OPD of IGH. Refractory in this context meant that the clinical condition was maintained or worsened during the use of topical corticosteroids and there was a relapse after withdrawal. Exclusion criteria: patients are on antihypertensive, antihistamines, antitussives, antiandrogen, contact lens wearers, previous history of ocular surgeries, history of autoimmune disorders, and those who have not given any consent. So the patients randomly were divided into two groups, subgroups A and B, each group containing 25 patients each. Both the groups were given 0.03% tacrolimus ointment which was applied twice daily. The group A was given tear drops as placebo along with the ointment, and group B was given 0.1% olopatadine along with the ointment. Both the eye drops had similar flasks, so with no identification which was given to the patients along with the ointment. For double masking, the eye drops were numbered and contained no identification of the drug. The content of the flask was revealed only at the end of the data collection period. The randomization was performed using a block system, and all the symptoms and signs were graded at 0 on a scale from 0 to 3 on day of presentation, after 30 days and after 90 days. To assess the safety and side effects of the treatment, itching, opacification, burning, intraocular pressure, lens, secondary infections or other possible complications were also assessed. The student's t-test for independent sample was used. To compare the results for the two assessment times within each group, the student t-test for paired samples was used. When comparing the two groups regarding the qualitative variable, Fisher exact test and chi-square test were used. P-values less than 0.05 were considered significant. This is how we graded in 0, 1, 2, 3 for the symptoms and the signs. Coming to the results, in the study group of the age group of the patients, majority were found to be from 6 years to 15 years, out of which 82% were male and followed by 18% female, and 82% were school going children followed by preschool children and followed by children working outdoors with their parents. 80% of patients were from rural area. Majority of the patients were of bulbar variety, 46% of VKC, followed by palpebral 34% and mixed 20%. Total 11 out of 50 patients, that is 22%, were presented with corneal involvement, out of which 13.04 were of bulbar form, 4 out of 17, 23.52% were palpebral form, and 4 out of 10 were of mixed form, shows the corneal involvement. SPKs were present in 7 cases, epithelial scarring in 4, and corneal involvement was observed more among patients having palpebral or mixed type of diseases. So these are the graphs which show the conjunctival hyperemia on day 0, 30 and 90, and followed by tarsal papillary reaction, punctate epithelial keratitis and limbal gelatinous infiltrate. This is the itching score over time. This is the tearing score, foreign body sensation score over time, photophobia score over time, discharge score over time, and this is a combined graph which shows the signs and symptoms were found to be reduced at day 90. So refractory VKC is a difficult condition to treat. Steroids relieve the signs and symptoms, but long-term use is known to cause serious side effects. So in this study, we compare the isolated tacrolimus with combined use of tacrolimus and olopatadine. The majority of the VKC were found to be at 5 to 25 years old of age, with age of onset between 10 to 12 years of old. Sacchetti et al. Discovered that VKC patients with corneal involvement or more than one recurrence per year had an increased risk of permanent visual loss. In present study, 11 out of 50, 22% were with corneal involvement. To conclude, the isolated use of tacrolimus and the combined use of tacrolimus with olopatadine have similar efficacy in reducing the clinical symptoms and signs in cases of VKC, which are refractory to conventional therapy. These are the limitations of my study and my references. Thank you.
So in one group you have used tacrolimus and in another tacro with olopatadine.
Olopatadine.
So any study with only olopatadine?
Only olopatadine? No, sir.
Can we compare only olopatadine twice or tacrolimus by time?
So we were trying to treat for the refractive cases. So we have included tacrolimus as the main.
All are refractory cases.
Refractory cases.
After using steroids and all.
Yes, after using steroids, those who have not, the condition has not relieved or it was maintained, and while when we were weaning off the steroid, the patient was again relapsing.
Yes.
For those patients, we have tried tacrolimus.
I think your study correlates well with all other studies.
Thank you, sir.